Doctor, good morning. Thanks for joining us. And 2 vaccines are out there now. What does this mean in the fight against this horrible virus?
Good morning, Amy. Indeed, it's been quite a week in the vaccine field. We had a lot of red tape cuttings and celebrations this week. We had Pfizer that started rollout last weekend, Moderna to come with extra doses to the pipeline. We are looking by the end of December to have around 40 million doses from Pfizer and another 20 million doses from Moderna. We're looking at 30 million people being vaccinated in the span of 3 weeks. And as you know, those will be healthcare workers and those elderly in long-term care facilities that comprise most of the mortality numbers.
I know we were getting under saying, what a happy day. We are ready to get this vaccine. But there is still some, maybe people who are wary of it. There are some concerns, maybe with the speed that it was developed. What do you have to say, to those people to maybe put their fears, at rest?
And indeed, these vaccines have been developed so fast in a time like 10 months, never seen before. But keep in mind, this technology has been researched for almost 2 decades. So this is not really new in a sense. It's just been adjusted to COVID. But fears are based mostly on the time span on because it's been so politicized. And it's just so new that people have to look into. But there are ways we have to confront fear with facts. If we start campaigns from the top, from influencers, celebrities, we've seen already Vice President getting his vaccine on TV. And also a lot of people want to discuss with their personal doctor. So a lot of talk has to be done at that mid-level. And I'm sure that as we advance more and we see more people vaccinated, millions of healthcare workers, I think people will be more like a grassroots movement. They will be more confident as they see it safe. And at the end, this is the only way we can get to a mask-free world.
Right now, those healthcare workers are getting those first doses of the vaccine. But with 2 out there now, more in the pipeline as well, when can we expect the public, when could all of us expect to get those shots in our arms?
The timeline for vaccines development, we're expecting actually in January to have also Johnson & Johnson. And we bought with them, we secured 100 million doses. If they get approved by the end of January, we'll be having 3 vaccines. Johnson & Johnson Advantage is going to be only 1 dose, and it can be stored at regular temperature, fridge temperature. It doesn't require a freezer or ultra cold freezer. So with 3 vaccines that kind of complement each other on the toolbox, we are still looking by early March or second quarter of 2021 to reach the general population.
Luiza Petre, some hope on the horizon there. We appreciate you joining us this morning. As you said, facts are the only thing that can help us as we get through some of our fears with all of this. Thanks so much for your time today.